everyone, I am Samyo Hangma Rai, and today we're going to study about a letter from a patient of grade 10. So let's begin the class now.
Unit 3, Health and Wellness. A letter from a patient. Dear healthcare worker, I recently experienced a parent's worst nightmare. One evening, my 9-week-old baby developed an extremely high fever. We rushed to our local community hospital and were admitted through the emergency department to the pediatric unit. We were discharged 3 days later, thanks to the skilled doctors and nurses who cared for our precious little one. While our infant's care and health outcomes were fantastic, our experience was less than satisfactory. During my hospital stay, many staff took the opportunity to badmouth their colleagues to me when we were alone. I am not sure if this occurred because I looked rather trustworthy or they wanted to let me know they were more competent than their colleagues. The emergency nurses complained about the doctor's orders and the delay in response of the pediatric nurses. The pediatric nurses complained about the emergency room nurses' inability to get an intravenous line. The pediatrician complained about orders made by the emergency doctor. Once admitted, our pediatric nurse complained about the pediatrician's approach to the care of my baby. Then, the pediatrician complained about the pediatric nurse's lack of ability to obtain a urine sample. At every opportunity, the parent in me wanted to scream at the top of my lungs. Can everyone stop complaining about each other and look after my sick baby? From my vantage point, it seemed that everyone was so focused on their own needs and skills that they appeared completely insensible that there was a sick baby that needed their help. In fact, it was downright disappointing. This did nothing other than state to me that egos were taking priority over my daughter's care. I cannot tell you how many times nurses told me, I am so busy today. I am not sure if they were telling me to excuse the fact that my daughter's medications were not on time or maybe they were simply looking for support. Every time I heard this statement, my head played my own version that sounded more like, your daughter is not a priority. Do not use patients or their families as your personal confidant. I was in that hospital room to care for my infant and see her condition improve, not to hear that staff were not equipped to see this goal through. Patients and their families need to know that they are your priority and your job is to care for them in an effort to restore health. Please take time to tell them this. Share positive news with them as if you are happy to, because I know you are. Use the chart, read it, write on it, and refer to it. After all, this is where everything that happens should be documented. At every interaction with the physician and their students, I was asked the same questions. Was she premature? And was your delivery normal? I answered these questions the same each time. Surely someone wrote this down in our chart. The majority of healthcare workers that approached my daughter referred to her as male. I would politely correct them with her or she. My daughter spent her time in hospital wearing only a diaper. Despite no obvious gender indicator, surely somewhere in my paperwork it indicated that she was female. As sleep deprivation and stress took their toll, I wondered what other mistakes may exist on my baby's paperwork. Please be careful of what you say to patients and how you say it. When you are caught on such a slip up, be genuine in your apology and make sincere effort to refrain from repeating the same mistake next time. Patients and their families need to know that you are listening and that you care about what it is they are saying. The gender error is one that left me with a sense of sloppiness and lack of focus on behalf of all those who made this innocent mistake. I am a healthcare worker just like you. People trust us to take care of their most precious loved ones in their most vulnerable states. This is our job and we do it with pride, but how we treat each other is dreadful. Patients know that healthcare is not a glamorous career choice. They know that most of us do it because we want to help sick people get well. Do your best to confirm this belief when people are in your care. I am not innocent of uttering some of these statements above. However, I can assure you that I will be more conscious of what I say to patients and their families after my daughter's hospital stay. Fellow healthcare workers, choose to interact with your patients in a way that instills confidence in yourself and your fellow team members. You alone have the power to positively shape the patient's experience. Yours truly, an appreciative mother. Exercises. Number A. Match the words in column A with their meanings in column B. Column A, nightmare. A very unpleasant or frightening experience. Number B, pediatric, relating to the medical care of children. Number C, intravenous, into or connected to a vein. Number D, priority, a thing that is regarded as more important than others. E, medications, treatment using drugs. F, confidant, a person with whom private matters and problems are discussed. G, deprivation, the lack of something considered to be a necessity. H, vulnerable, in need of special care, support, or protection. And I, dreadful, very bad, or unpleasant. Number B, write true for true and false for false statements. Number A, the sender of the letter was happy with the service of the health workers. False. Number B, the staff of different departments in the hospital had harmonious relationship with each other. False. Number C, the hospital staff were concerned with the requirements of the sick child. False. Number D, the staff of the hospital shared their personal feelings with the writer. False. Number E, the chart was unclear about the patient's gender. True. This is true because it probably was not mentioned. That's why people keep making the same error over and over again. Number F, the author took the mistakes of the health workers normally. False. Number G, the writer seems to be more sincere in her duty than the hospital staff. True. Number C, answer the following. A, what was the nightmare for the author? The author's baby, who needed to be hospitalized for developing a high fever, was a nightmare for her. B, what do you think is the main purpose of this letter is? The major agenda for the letter is to express the author's frustration and disappointment with the hospital staff. C, according to the author, what was the main weakness of the hospital staff? From the author's point of view, the hospital staff's lack of support and understanding was their major drawback. D, did the nurses really say your daughter is not a priority? Why did the author think so? No, the nurses did not say that the author's daughter was not a priority. However, their actions made her believe so. E, what do the patients and their families expect from the health workers? The patients and their families expect the health workers to prioritize the health and recovery of those who have been admitted. Homework. F, list the questions that the author was asked frequently in the hospital. G, why did the health workers make gender error about the author's daughter? H, according to the author, how do people perceive the career of health workers? How was your class today? If you have any feedback or suggestions, please feel free to email us at learning@dearwalk.edu.np. See you in the next class. Thank you.